Esophageal disorders are a group of disease processes in children that affect the esophagus, which is the tube that connects from your mouth all the way to your stomach. It is predominantly in the chest, and there are a whole range of problems that can occur, ranging from diseases that children are born with to diseases that are acquired, for example, ingesting a chemical that can cause injury to the esophagus. One of the most common esophageal disorders that we see is esophageal atresia. Atresia, by definition, means that the tube, or in this case the esophagus, completely stops midway through the chest. And then sometimes can continue on later down, but there's this disconnection, sort of a blockage in the plumbing. So in an atresia, that leads to two problems. The first problem is because there's a discontinuity in the tube, children cannot swallow. The second problem is there often is an associated fistula or abnormal connection between the esophagus and some other organ, in most cases the lung or the trachea. And so people have problems with reflux or abnormal things coming from the stomach into the lungs. About 85% of children have both esophageal atresia as well as tracheoesophageal fistula. Unfortunately, that's a relatively straightforward problem that we can correct. However, in the case of a pure esophageal atresia without a tracheoesophageal fistula, the gap between the two ends of the esophagus can be quite long, and in most cases, reconstruction is a lot more complex.